If you have been bathing recently, either taking a shower or in the bath and been washing down there and felt a bulge and been very concerned, I completely understand. This happens to many women regularly, but we do not talk about it. And most women will run to the doctor, obviously, because there's something sticking out down there and they don't know what's going on. And often the doctor will immediately recommend surgery. However, there are some things that you can do at home, as well as working with a specialist, that can help relieve your pelvic organ prolapse without having to have surgery. So today we're going to discuss those things that you can be doing at home, as well as what you should be looking for in a specialist if you determine that you do need help. First off, I want to tell you that just because you have a pelvic organ prolapse does not mean you need to have surgery. I have literally helped hundreds of women avoid surgery for pelvic organ prolapse. It's not an easy path. I will tell you that it takes a while. It's not a quick fix. However, neither is surgery. And many of the doctors will say, oh yeah, we'll just do the surgery. We'll put this mesh in. We'll sling this up here. We'll do this or that. And the problem will be magically solved. However, the surgery is going to cause scar tissue. It's going to cause other issues potentially, which could lead to difficulties later in life. You see, I've also treated many women who are in their 60s, 70s, and 80s who have had a sling surgery or had surgery for a pelvic organ prolapse, and it hasn't aged well. So now they're having further difficulties, like maybe the pelvic organ prolapse has come back, they're having difficulties with urinary continence, they're having hip pain, and it makes it more difficult when we have a mesh in there or when we have scar tissue that's 20 years old, because it's more difficult to deal with those issues. I mean, hey, it's more difficult to deal with an issue that's 20 years old as opposed to an issue that happened recently. So I highly encourage you to watch this video, learn these tips, implement them at home to see if you can avoid pelvic organ prolapse surgery and the potential secondary side effects that you may not see for 10 to 20 years. And in today's video, we're going to focus on the very basic things that you can do, and I'm going to try to keep things as simple as possible. These things are things that you can be doing at home, but they are the base contributors to a pelvic organ prolapse. So we're going to be talking about things like exercise, diet, and lifestyle, the things that you can be implementing to decrease your risk of pelvic organ prolapse and also to decrease it from progressing. All right, diet. I know you think I'm going to be giving you some amazing diet tips. Just eat this or don't eat that, and it's going to be the one magical solution that solves your problem. However, if you've been on this channel for a while, you know there's never one magical solution that solves this problem. And I do like to keep things very simple. So let me explain the key principle with your diet. You need to make sure that you are pooping every day. And when you're pooping, you want it to be a fat snake that kind of curls in the bowl. If you have little rabbit pellets, then you need to drink more water because you're probably not hydrated enough. And if you're not pooping every day, then this can cause increased pressure in your bowels. And that increased pressure in your bowels puts increased pressure on the pelvic floor. So it makes it hard for the pelvic floor to work correctly when it has increased pressure. So I know that that doesn't give you a specific thing that you should do, but that does give you a specific goal to reach for. Now, if you're like, I am way far away from being able to do that, I'm going to encourage you to seek help from someone like a naturopath, an acupuncturist, or a nutritionist to help deal with that particular issue, because that's going to take a lot of stress off of your pelvic floor. The other thing I want to encourage you to do in regards to diet is to stay well hydrated. One, it will help you to poop, but two, it will also help to clean out everything else in your body. Now, what is the definition of well hydrated? For me, it's drinking enough water that your pee is clear, and then drinking enough water to keep your pee clear. Now, for everybody, that's a different amount of water. But again, I like to keep things simple. If you're using the pee test, you can check it every single time you go to the bathroom. Now, obviously in the morning, first thing when you get up, your pee is going to be more concentrated because it's been sitting there overnight. That's fine. Just regularly throughout the day, make sure you're drinking enough water that your pee stays clear throughout the day. Which leads to the next tip, in that you need to make sure that you're able to fully empty your bladder every time you go to the bathroom. And you want to make sure that you don't allow it to be full for a long period of time. You see, if you're having to hold that urine in for a long period of time, that also forces the pelvic floor to get really contracted and tight as it's trying to keep everything in. And if this is you, you may have noticed that when you laugh or cough or sneeze, you have a little bit of leakage, especially when your bladder's full. Well, the reason for this is that the pelvic floor is trying so hard to just carry around that full bladder that then when you do something higher intensity, like laughing, coughing, or sneezing, it's more difficult to hold onto. And that can cause pelvic organ prolapse because the pelvic floor just kind of taps out. It's just too hard to work. And eventually the organs can just push through. So for your diet, remember, you want 1, fat snakes every time you poop. 2, you want to make sure you're pooping once a day. 3, you want to make sure that your pee is clear. And 4, you want to make sure that you are emptying your bladder regularly. All right, moving on to exercise. I want to tell you that the best thing that you can do if you're suffering with any pelvic floor dysfunction, but especially pelvic organ prolapse, is walking. Now, I will say with the caveat that some people who are suffering with pelvic organ prolapse feel like when they go walking, it actually increases the prolapse or increases the pressure or increases the sense of fullness that they have. So if that's you, then walking for a prolonged period of time is not a good idea. However, I have equally had patients who, when they walk, they feel that pelvic floor engage, which helps to decrease that prolapse. So I remember one patient in particular who had more difficulty with a pelvic organ prolapse when she was standing for prolonged periods of time. So I recommended that she try walking regularly throughout the day, just 5 to 10 minutes, because she worked from home, so she had that flexibility in her schedule. And what she noticed is that every time she went for a walk, that pelvic organ prolapse would lift back up and she would not be able to sense it anymore. So that's what we're looking for in regards to walking, that at least your symptoms don't increase. Now, if walking increases your symptoms, then obviously that's not a good tip for you. But getting some cardiovascular exercise can still be really helpful when you're dealing with pelvic floor dysfunction and pelvic organ prolapse. So for you, what may be better is doing a stationary bike, particularly a recumbent bike, because that will decrease stress on the pelvic floor, but still allow you to get that blood flow, which can help. So when it comes to exercise, cardiovascular exercise is super important, but you have to find an exercise that doesn't make your symptoms worse. So walking is ideal because it directly impacts the pelvic floor. However, if that is bothersome for you or increases your symptoms, then I recommend something like biking to make sure you're getting that cardiovascular exercise and not putting increased load on that pelvic floor. Now, we cannot talk about exercise without talking about the dreaded Kegel exercises. And so many women who come in to see me have either tried Kegel exercises and felt they made their symptoms worse, or tried Kegel exercises and weren't sure if they were doing them correctly, or tried Kegel exercises and still had a pelvic organ prolapse, so they're wondering what the heck happened. I want you to ditch the Kegel exercises. I do not believe that they help, particularly in pelvic organ prolapse. And instead, I want you to do this exercise. I made a video. I'm going to link it here. I'll also link it at the end of this video so you can go check it out. And it really explains the exercise that I do want you to be doing, as well as why I want you to be doing that exercise. But basically, the exercise is geared towards working the deep hip internal and external rotators, which are bigger muscles that are in the hip that help to passively contract and relax the pelvic floor. So the thing is, with a prolapse, many people think that it happens because they have a weak pelvic floor. Chances are really good that it's actually because your pelvic floor is too tight. So this exercise will help to not only relax, but strengthen your pelvic floor at the same time. Now, you may not be believing me yet, and that's okay. Go try the exercise and get the proof for yourself. However, I will tell you, I had a patient who came in who had given birth recently, and she was having a pretty significant prolapse. So her OBGYN sent her to pelvic floor physical therapy. Now, since her symptoms were new, the pelvic organ prolapse had just happened, it was pretty easy to treat her. And within 4 visits, we were able to completely eliminate her pelvic organ prolapse. Now, that does not mean that she was done with treatment. There were still other issues as her body was recovering from pregnancy. However, we did eliminate the prolapse. So at that point, she wanted to go to an in-network provider to complete her plan of care. And I will never forget, because she asked me, do you think that that would be okay? And I said, yeah, well, you're seeing a pelvic floor physical therapist, right? You're seeing a pelvic floor specialist. Then yeah, you should be fine. I don't see any problems. But we went ahead and scheduled an appointment for after she saw the in-network provider, just so we could follow up and make that transition as smooth as possible. So when she came in for that final appointment, so that 5th appointment, she said, that's it. I am never going back there. I am staying with you until I get this solved. And I asked her what happened, because I was confused, because she saw a pelvic floor specialist. And what had happened, she walked into that clinic with no prolapse. She said she was walking fine, normal gait pattern. She wasn't having to do the little dirt, 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 dirt kind of monster walk, I call it, because you're worried that everything's going to fall out. And so she was able to walk completely normally. She wasn't having to protect that prolapse at all. As part of the initial evaluation, they hooked her up to biofeedback and had her do like 1,000,000 Kegel exercises. I mean, if you've ever been through biofeedback, there's like, you gotta hold, and then you gotta do the quick ones and all those different things, because they're getting all of those different measurements. Well, of course, they didn't do any treatment because it was the initial evaluation. So they were just trying to find out what they were dealing with. But when she walked out of that clinic, her prolapse had fully returned. She had to do the monster walk where she couldn't take the steps. She was afraid she wasn't going to make it to the car. She felt like everything was going to fall out. And she got to her car and just sat and cried, because this pelvic organ prolapse had been resolved when she walked in. And now doing a whole bunch of Kegel exercises had made it worse. And I promised her then, and I'm telling you now, that I would share her story to other people so that they would understand that doing a bunch of Kegel exercises is not going to help your pelvic organ prolapse. In fact, it may even make it worse. And I know I may get a lot of comments about that, saying that I'm wrong, or they heard other professionals say other things. However, I've been doing this for over 20 years, and I am tired of people being misled by false information. All right, I'll get off my soapbox now. What's the next thing that you can do to help decrease your pelvic organ prolapse and help keep it from progressing? The next thing you want to do is really make sure you're using proper body mechanics. As women, we tend to use more of our back when we're trying to lift things, especially like children or even heavy boxes. We don't use our legs, and we also don't use our breathing. Many people, when they're lifting something heavy, will do breath holding, and that can actually increase the intra-abdominal pressure, which increases the stress to the pelvic floor, which can lead to a pelvic organ prolapse. So when you're doing something like lifting up a heavy object, you want to be breathing out as you're lifting up. Also, you want to make sure that you're bending your knees when you're lifting something heavy. But proper body mechanics goes beyond that. You want to make sure that you're sitting with proper posture. So your head above your shoulders above your hips. You want to make sure that you're sitting in the correct position so that you're not putting increased stress on that pelvic floor, which can be happening if you're doing something like slumping. When you tilt your pelvis posteriorly, this can actually cause increased stress to the pelvic floor and can increase your risk for pelvic organ prolapse. Or if you already have a prolapse, it can make your symptoms worse. So think about proper body mechanics as making sure that your spine and your pelvis are in good alignment, as well as not increasing your intra-abdominal pressure. Now, if you truly want to avoid surgery, you have decided that surgery is not an option for you, you're not looking for the quick fix, you're looking for the long-term fix, then I'm going to recommend you find a pelvic floor specialist who also is trained in organ mobilization. You see, here's the thing. For many women, as we age or after pregnancy, or if we have any abdominal surgery, what can happen is the organs can kind of shift around a little bit, which can actually contribute to that pelvic organ prolapse. You see, the organs are held in place in our abdominal cavity with these fascial slings. So basically the slings kind of put everything in their little compartments. However, if the slings get damaged for any reason, then the organs can kind of descend a little bit, and that can put increased pressure on the pelvic floor or even allow those organs to come through. So when you're dealing particularly with a prolapse issue, you want to make sure, one, that you treat the pelvic floor. That is obviously in dysfunction because it allowed for the prolapse. But you also want to make sure that you treat the organs and help get them back in the right place. Now, it's not like your organs travel all over your abdominal cavity, and it's a little bit difficult for people to get the idea of this because you never thought about the fact that your organs actually sit in slings and things. However, I can tell you that getting the fascia moving better and relieving tension in your abdominal cavity can do wonders for a pelvic organ prolapse. So if you're seeking help from a pelvic floor specialist, then I'm going to ask that you also make sure that they're familiar with organ mobilization so that you can get all the treatment that you need. So there it is, the top things that you can be doing at home right now to decrease your pelvic organ prolapse. We want to make sure that you're focusing on your diet so that you have a fat snake poop every day and that your pee is clear. We want to make sure that you're doing some exercise, preferably exercise directly for your pelvic floor, as well as cardiovascular exercise. And please don't ever do a Kegel again. You have my permission right now. I'm writing you a permission slip. You never have to do a Kegel exercise again. But do go check out this video over here to make sure that you're doing the right exercise. And 3, decrease your risk of a pelvic organ prolapse progressing by making sure you're using proper body mechanics and you're sitting with proper posture. If this video is helpful for you, please click that like button. And if you know someone who is suffering with a pelvic organ prolapse, please share this video with them.